Coronaviruses are a family of viruses that range from the common cold to SARS and MERS. Not all coronaviruses are the same. This video addresses the 2019 novel coronavirus that causes the disease COVID-19. The goal of this video is to make you more confident on the correct use of personal protective equipment, PPE, in the care of a patient with or being ruled out for COVID-19. As we learn more about COVID-19 and its transmission, CDC now recommends the use of droplet and contact precautions, as well as eye protection, when caring for patients with COVID-19 that are not receiving aerosolizing treatments, such as intubation, invasive ventilation, non-invasive ventilation, high-flow oxygen, nebulizer treatments, open suction, or bronchoscopy. Droplet precautions require that staff wear a procedure or surgical-style mask. Contact precautions require gown and gloves. Team members will need to gather the following PPE prior to donning: gloves, non-permeable gown, procedure mask, and face shield or goggles. Always do good hand hygiene before putting on PPE. You may use either alcohol-based hand rub or soap and water when caring for patients with COVID-19. No matter which method you choose, be sure to disinfect all surfaces of hands, including between fingers and around nails. Both methods of hand hygiene should take at least 20 seconds. As with any patient, please choose soap and water hand hygiene when hands are visibly soiled. Hands must be completely dried before donning PPE. For a droplet and contact precaution rooms, start with a gown. Make sure to fully cover your torso, from neck to knees, arms to end of wrist, and wrap around the back. Make sure the gown is tied and thumbs are through the thumb hole. Next, put on your mask. Depending on the style of mask, you should tie the mask by placing the top tie at the upper middle portion of head and place bottom tie at the base of the neck, or use the ear loops. Next, adjust bridge of nose and form mask snugly around face and make sure it covers the chin. Next, don goggles. Lastly, put on gloves and extend them to your wrist so there's not a gap between gown and gloves. You are now ready to safely enter the patient's room. Now that you are done in the patient's room, it's time to remove the PPE. Take your time and be careful. The gown front and sleeves and the outside of gloves may be contaminated. Grasp the gown in front and pull away from your body so that the ties break, touching outside of the gown only with gloved hands. While removing the gown, fold or roll the gown inside out into a bundle. As you are removing the gown, peel off your gloves at the same time, only touching the inside of the gloves and gown with your bare hands. Place the gown and gloves into the trash and perform hand hygiene. Now, remove your face shield or goggles without touching the front, as it may be contaminated. Carefully hand your reusable eye protection to the door monitor for cleaning, and perform hand hygiene. The door monitor will clean eye protection, doff gloves, and perform hand hygiene. Next, the caregiver will perform hand hygiene and exit the patient's room. Note, you are still wearing your mask. Finally, remove your mask. When doffing mask, it is crucial you do not touch the front of the mask, as it may be contaminated. While leaning over the trash receptacle, remove mask by untying the bottom tie first at the back of the head, followed by the top tie, disposing of mask into trash. If you're using an ear loop mask, remove one loop at a time, and after removing your mask, perform hand hygiene. Good hand hygiene precautions and proper use of droplet and contact precautions will help keep you, your patients, and your fellow team members safe during the care of patients with COVID-19.